All right, guys, it's Curtis again. Chapter 3, EMR class, lifting and moving patients. Let's get into it. So, as an EMR, we got to do several things when we start talking about being an EMR, and we're talking about lifting and extrication and getting people from the bad place to a better place and onto the cot and out of a ditch and all those things. So, one of the things we got to do is we have to analyze the emergency situation. So we have to analyze and figure out if this is a safe situation, if we're going to be able to do this by ourselves, how much backup do we need, all of those types of things. So also in that same deal, we might be looking at how fast are we going to need to do this based upon the patient's condition. So we need to quickly evaluate the patient's condition and then actually put all of that kind of into a formalize how we're going to do things, and then carry out those, as you see there, effective, life-saving emergency medical procedures. So then we got to figure out how we're going to put all of that together and do it. So emergency medical procedures, they may include lifting or moving, positioning patients, and assisting other EMS providers in moving patients, and then preparing them for transport as well. So in some cases, your knowledge of emergency movement techniques can help save patients' lives, because you may understand how you can and can't get people out of bad situations, and in a really bad situation, that can be very helpful. So the recovery position, which you see here, unconscious patients who have not sustained suspected trauma should be placed in a side-lying or a recovery position. What this does is it helps them to keep their airway open. So another thing is, as you can see, because of the help of gravity and everything, it's also going to allow for secretions to drain from their mouth. So this is going to be your recovery position, as you see. So unconscious patients who have not sustained suspected trauma should be placed in this. Now, every time you move a patient, you need to keep these general guidelines in mind. Obviously, we do not want to do any further harm to the patient. So if they're already broken, we don't want to make things worse. We only want to move them when it's necessary. We want to move them as few times as possible. We want to move them together as a unit, so one piece, and then use proper lifting and moving techniques. And that's to ensure your own safety. So you want to make sure that you're using good lifting techniques, which we're going to talk about in the lab quite a bit. And then have one rescuer give commands when moving a patient. And usually that's going to be that rescuer that's at the patient's head that's immobilizing their C-spine. But you definitely want to work together as a team. Now, also, though, consider these recommendations. So delay moving the patient, if possible, until additional EMS personnel arrive. So someone that might be pushing kind of the weight limits of the crew, of what they're capable of doing. If you're not in a critical situation, maybe you have the ability to wait until another crew gets on scene and can give you help. Treat patient before moving him or her unless the patient is in an unsafe environment. That's something you might want to think about. So maybe they need, some breathing help, or maybe they need some chest pain medicines, so maybe some nitro and that kind of stuff. Try not to step over your patient. So by doing that, you only make a stepping hazard, obviously, a tripping hazard, but then you can also get junk off your boots, sand, dirt, all that kind of stuff that you've been traipsing through can certainly fall onto your patient. So, and then we'd want to let them know what we're doing. So explain it to the patient what you're doing. Usually no real hurry, in the moving process. If they're not critical, it's not necessarily a big deal about hurry. So if you suspect that the patient has sustained trauma to the head or the spine, you want to keep their head and their spine immobilized so that so they don't move. That's one thing we want to make sure is we don't want to make things worse. And if they have spinal damage, we don't want to make things worse. So we want to keep the rules of good body mechanics in mind, and you'll see that stuff in your book, and we're going to talk about it. But know your own limitations and what you're capable of. Keep your feet shoulder width apart to maintain balance and a firm footing. Maintain the natural curve of your spine. Do not bend at the waist. Use your legs. And try to keep your arms close to your body. Don't allow your arms to drift, out in front of you or whatever, because all that does is start putting a lot of strain where it doesn't need to be. Avoid twisting your body. There's a lot of back injuries that happen not simply from just lifting someone up off the ground. It's just from a simple twist. So avoid twisting your body when carrying a patient, and then move that patient as few times as possible. What that does is decrease the chance of them getting hurt and you getting hurt by moving them as few times as possible. So you can see here kind of what you might see listed as kind of a power lift. We've got what we talked about, feet wide, shoulder width apart and bending, and you see all the top things that you're supposed to be. So top priority as an EMR is to ensure your own safety. So improper lifting or moving techniques, those things can result in you hurting yourself. So good body mechanics reduce the possibility of that injury. So use the strength of the large muscles in your legs to lift patients instead of your back muscles. So you're using your legs and not your back. You've probably heard that many times before in other situations or environments, and we want to make sure we're following good lifting rules because there's no sense in you hurting your back. Keep your back straight as you lift. Lift without twisting. Ensure you have firm footing before you start to lift or move a patient. Assess the weight of the patient, and then know what you're capable of doing. Know what you and your crew and you guys together are capable of doing. Call for help if you need it. Communicate with other members, and then practice lifts and moves. We'll do a little bit of that in the lab, but you should be doing that wherever you're at, whether you're at an industrial area or on a volunteer fire service. You should be practicing some of this stuff. You don't want one of the first times you've ever done something to be in the middle of a critical situation. Now, emergency movement of patients. So move a patient immediately in the following situations. So danger of fire, explosion, structural collapse. Most of this you're probably going to go, well, yeah, no doubt. Not much to talk about. Hazardous materials are present. Emergency scene cannot be protected. So, middle of a highway and it's not being shut down and, in the middle of a dangerous situation. So it is otherwise impossible to gain access to other patients who need life-saving care. And then patient has experienced cardiac arrest and must be moved so you can begin CPR. Those are all when you move people immediately. Close drag, one way you can get a hold of somebody and move them out. Patients on the floor or maybe on the ground during an emergency situation. You may have to drag them away from the scene instead of trying to lift and carry them. So you pull the patient in the direction of the long axis of their body to provide as much spinal protection as possible. So you're dragging them, maintaining kind of just that straight line, not sideways is what it's saying. Close drag. So simplest way to move patient in emergency is what we're talking about is this close drag. If the patient's too heavy for you to lift and carry, you grasp their clothing in the neck and shoulder area, and then you try, if possible, rest the patient's head on your arms for protection, and then just drag them out of danger. So not obviously the best way to get somebody out, especially if you think they may be hurt and broken, but in these emergency situations, this may be something that you have to do. Cardiac patients and the close drag. So in most situations, you can easily determine whether emergency movements are necessary. So, cases involving cardiac arrest, patients are going to be your exception, really. You must judge whether BLS or ALS can be provided in a small space. So if room in which you find the patient is not large enough, then you need to move the patient as soon as you determine that he or she has experienced cardiac arrest. Drag the patient from the tight space and quickly move furniture out of the way so you'll have room to work. And that's one thing we need to do is take the time just to move things out of the way to give ourselves a little bit of room to work. Now, blanket drag. Patient's not dressed or is dressed in clothing that could tear easily during clothes drag. So if they're just in a thin little t-shirt, you're probably not going to be able to move them around very well. You might be able to move them onto a sheet or a blanket or even a rug. You want to place that blanket or that sheet under them, roll them onto it, pull the patient to safety by dragging the sheet or the blanket. And then a blanket drag can be used to move a patient who weighs more than you do as well. So maybe there's only one of you and one patient, and they're substantially outweigh more than what you're capable of. This is a good way to be able to get someone to safety. Then you see arm-to-arm drag. So if the patient's on the floor, you can place your hands under their armpits from the back of the patient and grasp the patient's forearms. So the arm-to-arm drag allows you to move the patient by carrying the weight of the upper part of the patient's body as the lower trunk and legs drag on the floor. So this can also be used if you find you, like earlier before we talked about that blanket or sheet drag, to where if they're a little bit heavier than what you're able to do, you might be able to use this. This also offers probably a little bit more protection maybe for their head and neck. And then a firefighter drag. They're going to put, as you see in the picture, loop their arms up around you and use that as kind of the pulling device. So the firefighter drags or it enables you to move a patient who's heavier than you are. So you tie the patient's wrists together with anything that's handy. Make sure you don't impair their circulation, though. That can be a bit of a problem. Get down on your hands and knees and straddle the patient. Pass the patient's tied hands around your neck, straighten your arms, and drag the patient across the floor by crawling on your hands and knees. An emergency drag from a vehicle. So one rescuer. Emergency drags are used in life-threatening situations where no equipment is immediately available. So the basic movement principles apply, but the techniques are slightly modified because the patient's not lying down. So one rescuer, grab the patient under the arms and cradle the patient's head between your arms, and then pull the patient down into a horizontal position as you ease him or her from the vehicle, and then prevent excessive movement of the patient's neck. With this being an emergency thing from a vehicle, drag from a vehicle, there might be some thought that they could have some trauma damage. So you definitely want to try to prevent movement within the patient's neck. So here's kind of some pictures of what we're talking about. Grasp the patient under the arms and then pull the patient down into the horizontal position. Now, 2 or more rescuers. So one rescuer supports the patient's head and neck, while the second rescuer moves the patient by lifting under the arms. This is a pretty common way to move people. You may even do this in someone's house or whatever, not necessarily, getting somebody out of a vehicle. But the patient can then be removed in line with the long axis of the body, with head and neck stabilized in a neutral position. Now, use a long board, obviously, a long backboard if time permits. That's kind of what we're talking about, though. This is an easy way to move. I've seen it done many times, too, where the front person in the front by the knees, they might be backwards if they have good footing and able to walk, without being tripped. So these are good carries for non-ambulatory patients, patients who are unable to move because of the injury or illness, or maybe they're just bedridden or whatever. 2-person carry, extremity carry. So these can be performed by 2 rescuers with no equipment. Uses patient extremities to move. Rescuers help the patient sit up. One kneels behind the patient, reaches under the patient's arms, and grasps their wrist. The rescuer 2 then backs in behind the patient's legs, reaches around, and grasps behind the knees. That's going to be the 2-person extremity carry. We've got lots of them here. So 2-person seat carry. Rescuers use their arms and bodies to form a seat for the patient. So you can see that their arms are locking, and you're able to just able to move someone out by creating almost a seat with your arms. So you kneel on the opposite side of the patient near the patient's hips, raise the patient to the sitting position, and link arms behind the patient's back. So then you place other arm under the patient's knees and link with each other. And then if possible, patient puts his or her arms around the necks and shoulders of rescuers for additional support. It's able to kind of take a little bit of the weight off of their arms and make it a little bit more stable, like what you're seeing here. And then the cradle and arms carry. So this is a good way to carry a child. I don't know that carrying an adult's a great way to do this, because obviously you're leaving yourself open to a lot of injuries. But kneel beside the patient, place one arm around the child's back and other arm under their thighs. So lift slightly and roll the child into the hollow formed by your arms and chest. And then the important part of this is to make sure you use your leg muscles to stand. What I can tell you is in some high intensity situations, these kind of things seem very appropriate to do. And then afterwards, your back tells you that that wasn't necessarily a great idea. So if you have the ability for someone else to help you or to do it a different way, make sure that you're making good choices. Here's a chair carry. It's always a good way to get someone out of an office or a kitchen or something like that. The rescuers use a chair to support the weight of the patient, and then you're just lifting up, as you see, to be able to move the patient once again as a unit, as one. And the chair is supporting the patient. Especially useful for taking these people up, for patients, up or down stairways or through narrow hallways as well. Pack strap carry. So it's a one-person carry that allows you to carry a patient while keeping one hand free. Have patients stand and back into the patient so your shoulders fit into the patient's armpits. Good old piggyback, I guess. Probably not recommended for back health. Direct ground lift, used to move the patient who is on the ground or the floor to an ambulance or stretcher. Used for those patients who have not sustained a traumatic injury. That's one thing you need to think about with these is, is there potential that they have a cervical spine injury? So if they've had trauma and a chance of cervical spine injury, then we may need to think about the way, or not may, we do need to think about the way that we are moving them from the scene into the onto a board or into the ambulance or whatever. So this has a skill drill attached to it. You'll practice this in lab, and you also have those little sheets that show you, the skill drill itself. More and more lifting. So hang on. There's not a lot of fun stuff in lifting. It's just lifting. So we're just going to talk about a little bit. Not a lot of cool EMT stuff, but EMR stuff. But it is what it is. So transferring a patient from the bed to the stretcher. May request your assistance with a patient transfer from the bed to the ambulance stretcher using the draw sheet. So you're just going to move everybody right across as one. Loosen the bottom sheet underneath the patient or log roll them onto a blanket. And then we want to make sure we're just grasping the sheet and blanket at all the corners and moving it across, kind of like we see here. You're just sliding them right across the bed onto the cot. Here's kind of a walking wounded, way. You can, one person walking assist. So think about, you maybe roll up and there's a car crash or whatever. Someone just fell down and went boom. They're a little banged up. They need a little bit of help. This is a good way. So you see he's got his her arms around, and he's holding on and able to assist this person to get to safety, or just go sit on the side of the curb or whatever. Two-person walking assist. So useful if the patient cannot bear weight. So if you don't have ways to move this patient, if they can't, this is useful if they cannot bear weight. So the two rescuers are going to completely support this patient. Now, wheeled ambulance stretchers. This is a pretty common one. Nowadays, we have the motorized ones that they lift for us. You may work in a service, though, that does not have the luxury of having that, so you'll need to make sure that you know how to operate your particular equipment. But wheeled ambulance stretchers carried by ambulances. This is obviously one of the most commonly used EMS devices, because it doesn't matter if they just fell down or went boom or their heart quit working. All of the above get onto a cot. So if you hear the word cot or stretcher, that's kind of what we're talking about here is this device right here. So most can be raised or lowered to different heights. We're way past the emergency days where it was, lower it down as a unit, move it up as a unit, everyone ruining their backs and all of that. So now these things are motorized, whether it's by electric or sometimes some of them, I've never actually seen one, but I know there are models out there that you can hook an SCBA up to as well. So there's a lot of different things out there. And, all it takes is one back injury, and an ambulance service can be put into, or a city can be put into a real bind. So probably a lot cheaper just to buy these supported devices. But you make sure you that you put belts on to secure your patient when you're going up and down in these. And like I said, make sure you understand how to use your particular device. So stretchers can be rolled or carried by 2 or 4 people. So if it's smooth, the wheeled stretcher can be rolled with one person guiding the head and one person pulling the feet end. If a loaded stretcher must be carried, it's best to use 4 people. So in the event you're having to move it around a little more physically, you want one on each corner for sure. Portable stretcher. So used when the wheeled stretcher cannot be moved into a small space. This is smaller and lighter, so it's a little easier to get around. Stair chair. This is a really old one, but we'll have one here that we'll show you that is hopefully what you'll see out in the field may or may not be. It all depends upon people's budgets, but stair chair is something that you may or may not need to use. If you work in a place that doesn't have many second, third, or all the way up to however many floors, you may not need a stair chair. But portable moving device used to carry a patient in a sitting position. So, if a patient's short of breath and they're more comfortable in a sitting position and you need to get them from point A to point B down to the cot or something like that, that may be a good option for you. Immobilization devices. And now we're going to talk about, basically we're talking about some long spine board type things, some backboards. So they're used to immobilize patients who have neck or back injuries. And obviously you can use these things too to help, when you're just lifting people. So it's pretty common when I was making calls that I would put hip fractures on them just to be able to move them. They didn't need necessarily a backboard, but it was an easier way to move them. Or if you need to secure somebody, you need to have something that you can secure them to. So a board is a good idea in a lot of situations. It's not necessarily just meant for car crashes and all of that. So they're made of fiberglass, and the patients are placed on long backboards. We need to make sure we secure them with straps because they could easily roll off. If they sustained back or neck injuries, as you see, we should definitely immobilize their head as well. Then you have what you see as a KED or a Kendrick extrication device. So this can be this is good for patients that are in a sitting position that need to be maybe taken out of a vehicle, and you have lots of time. This takes some time. People don't use these very often, but they do also work well as boarding a small child. So you can put the small child in here. This will wrap around their body. This actually can go right kind of around the head and immobilize their head. And this works pretty well to immobilize some children. Then you have a scoop stretcher. So the nice thing about this is it comes apart, separates into a right half and a left half. You would apply these by placing one half on each side of the patient, and then you attach the two of them together. They'll snap together. So these are helpful when moving patients out of small spaces. These are not the greatest thing if you have somebody that might have a cervical fracture, but when you need to move somebody, if this is all you have, this is what you have. In an emergency situation, you can use the following objects for improvised backboards. So you see all of those things listed. When we're talking about a tornado or something, you're not going to have probably near enough backboards to start immobilizing people. So anybody that's worked mass casualties has probably seen many of these things that have been used to immobilize someone or at least move someone on. So treatment of patients with suspected head or spine injury. So anytime a patient has sustained a traumatic injury, you need to think about there could be some damage to the head or their neck or the spine. So in the event that there is, and we don't do a very good job of treating them, we can cause some permanent damage or maybe even paralysis. So we need to immobilize their head and the neck in a neutral position. So first off, we'll be doing that with our hands, or what you might hear referred to as manual stabilization, maybe a blanket roll or even foam blocks that'll hold their head in place while they're on the board. So once you release manual stabilization, there should be something there to take over to keep their head immobilized. Here's some collars. So applying a cervical collar used to prevent excessive movement of the head and the neck. Collars do not completely prevent movement, but it minimizes it. So it's always good to kind of give someone a small lecture about, this is to help you, to remind you to not move your neck. These things do, for the most part, do not stop people from moving their neck. So they don't provide sufficient support when we're talking about trauma patients. And then we'll go over this in lab as well, but you can see here, they have manual stabilization, and then you're applying underneath the neck, going around the back at the same time, and then bringing it around and securing it. So cervical collar should be applied before the patient is placed on the backboard, in kind of the grand scheme of how all of this works. So movement of patients using backboards. Placing a patient on a backboard is not your primary responsibility, but you may be required to assist other EMS with this task. So it's not your primary responsibility to do that, but you might it might be beneficial if you were to help the people that it is their job. So any patient who has sustained spinal trauma in a motor vehicle crash or fall, and any person who has sustained major injuries to the trunk should be transported on a backboard. We should, until proven otherwise, assume that they have something wrong. Now, if you do suspect that they have a spinal injury, you want to move the patient as a unit. We talked about that before, moving everything as a unit, as one piece. You want to transport them face up, keep their head and neck in a neutral position, and then be sure that all rescuers understand what is to be done before attempting any movement, and be sure one rescuer is responsible for giving commands. So as we mentioned, typically it's that person that's on the head or the neck, and they're going to say, 1, 2, 3, lift, and then everyone lifts up as one. Assisting with short backboard devices. So these things are going to be used to mobilize patients found in a sitting position. We talked about it before. It was that green device, that KED. Maybe they sustained some trauma to the head or neck or spine. And what it does is allows rescuers to immobilize a patient before moving him or her, or before moving them. So after a short backboard device is applied, patient is then placed on a long backboard. And you may need to assist with this. So you need to make sure that you're familiar with it, however you guys do things wherever you're at. Now, log rolling, that's going to be usually kind of the primary technique that you use to move patient onto a long backboard. And typically, it's best if you've got maybe, curriculum will tell you that a team of 4, that's a lot of hands though, but 2 to 3, up to 4 people, it's a good way to get people onto a board. That's the movement technique of choice when we start talking about people with a suspected spinal injury. You're able to log roll them over, put the board underneath them, log roll them back. Once again, we're moving them as a unit, so that's kind of one of the advantages of that. And again, it's going to be the person that's up on the head. That's going to be the person that is controlling this or kind of calling out commands. So patient movement commands have 2 parts: a question and the order for the movement. So any log rolling technique, you must move the patient as a unit and then keep the patient's head in a neutral position all the time. So straddle lift, as you see here, not stepping over, straddling the patient so we're able to get patients moved properly. It can be used to place a patient on a backboard if you don't have enough space to perform a log roll. So they're lifting them up and then putting the board, as you can see, underneath the patient. So straddle lift. Lift the patient as a unit, slide the backboard under the patient. You hopefully see kind of this common thread, this common theme of you moving them as a unit. That's going to be an important thing. That's how hopefully we decrease any chances of furthering injuries. So that particular lift that we talked about, the straddle lift, requires 5 rescuers. So 1 at the head and neck, 1 to straddle the shoulders and chest, 1 to straddle the hips and thighs, the leg, 1 for the legs, and 1 to insert the backboard. So the most difficult part of this technique is coordinating the lifting so the patient's raised just enough to slide the backboard under the patient. So here's kind of what we're talking about. This is the straddle slide. So it's a modification of straddle lift. Lift the patient as a unit, slide the patient forward about 10 inches at a time, and then you slide them up onto the board. Then some straps. You got to be able to strap people on there. This tells you that straps 6 feet to 9 feet long with seatbelt type buckles work well. Everybody should have seen some straps. We're going to use those straps to put people on boards. We're going to use straps to put people on the cot. We're going to use straps no matter what. This is showing you what it might look like for someone that was placed onto a long spine board if we suspect that they have a spinal injury. As you see, once that patient is is kind of centered on the board, secure their upper torso with straps, then secure the pelvis and upper legs, and you can use pads as needed. So you might see that for some people, these voids, here we go. These areas here can provide some problems. So it's not a bad idea to, roll some towels up and put those in there or whatever to pad some voids. So it makes it a little bit more comfortable for people, as well as they don't move. Depending upon how they're being moved, they won't slide around on the board as well. A blanket roll improvised device that works well is readily available. So it will show you in your book in a skill drill of what that looks like. But it works well, is almost always available. Once again, it's an improvised device. So we talked about being able to improvise in the event that you need to. So when we're talking about any of these procedures, head stabilization must be maintained through the entire procedure. So we want to make sure that we are maintaining C-spine integrity when we're talking about any of these moves. You can see they're putting on some foam blocks on there. That's what we talked about, getting the collar on them. You're going to have manual stabilization. You see in the top left, you see that they have a head on her. And then once we get the blocks on, those blocks take over for manual stabilization. And that's what that looks like whenever we go get somebody immobilized. Our summary. So obviously, don't harm them any more than they already are. Only move them when you need to. Move the patient as little as possible. As a unit, we've talked about over and over, make good lifting and moving techniques. Recovery position is going to be important because gravity helps us to allow things to get out that needs to get out, that the body wants to get out. So do not lift or move a patient if you suspect a spinal injury unless it's necessary. So, once you get them, maybe in the event that they're in, it's not necessary at that moment. So hang on. Let's get a collar on them. Let's get everything that we need. Otherwise, if you have a life-threatening situation, then we're going to have to do one of those lifts that we talked about. And a cervical collar prevents, where that word prevents, it doesn't stop, it just prevents it. It helps to decrease excessive movement of head and the neck. Log rolling, primary technique. There's log rolling a lot to get people on the backboard. So that's it. That's chapter 3, lifting. Not very exciting, and I hate to be the bearer of bad news, but the next one might even be not as fun. So we'll see you on that one. Have a good day or evening.